It is Thursday, make that December the 17th. We are on program number 162. And welcome to the COVID-19 Task Force update. On today's program, Dr. Annick Gauthier will be here talking about, well, just stick around for it because she's got plenty to talk about. We have the immunizations coming up later on. They are forthcoming. She'll talk about that. But before we have Dr. Gauthier on, we'd like to bring back the Chief Peacekeeper, Dwayne Zacharie, who is, of course, a member of the task force, and he has plenty to report on. Dwayne?
Good afternoon, Kahnawake. Happy to be here tonight. I'd like to just say I hope everybody's keeping well and as well as can be under the circumstances, making sure you're taking care of your mental health. That's super important during this time because we have a lot of things that are going to be happening over the next few days. It's the holiday season, maybe not as festive, as we'd like, but we're going to do our best, hopefully, right? We're going to all work together to keep everyone else as well as ourselves safe. So I want to get right into it. The Kahnawake COVID-19 Task Force has a new directive. It's directive number 52. It's about travel to the United States. The Canada-US border remains closed as per the Canada Quarantine Act. The Kahnawake COVID-19 Task Force supports this measure, and the new directive essentially says anyone who is deemed to be in contravention of this act will also be deemed to be in contravention of the COVID-19 Task Force directive. Right? And what that means is you're going to be subject to enforcement by the Kahnawake Peacekeepers. So if you're traveling across the border and you're coming back and you're failing to isolate for the 14 days, you can then be ticketed, right? So it's a contravention. The fine for this for an individual is $1,541. So we're going to be looking out for that. We have good contacts with the Canadian Border Agency as well as some other law enforcement agencies. They keep track of who's crossing the borders. They inform us all the time, so we're going to be using that information as well, and we're going to be checking on it. We receive numerous calls every single day about people failing to follow this measure, and we're going to be enforcing it. So please, follow the measure. We don't want to have to issue fines. We've tried really hard over the last few months, 9 months to be exact, to do community policing. For the most part, most people do comply, but we still have complaints about certain people, and you know, the same names keep coming up, so we're going to be out there and we're going to be looking for it. So please be aware that there's a new directive and everyone in our community is beholden to it. Christmas is almost upon us, and there's a Christmas holiday guideline that's out now, and it speaks to how to essentially meet. I don't want to say the word gather because you cannot gather. The Kahnawake COVID-19 Task Force is advising the community on safe ways to visit over the holidays. The first and safest way to visit, obviously, is not to visit at all, right? Don't have people coming over to your house. That's the safest thing. Now, we do know it's the holidays, and we know that people are probably going to have someone visit. So what we're saying is the second recommendation, which is an increased risk. Remember, anytime you have people over, anytime people come to visit, anytime you have increased your number of contacts, you also increase the risk. You increase the risk for everyone in the community. So the second recommendation, which increases risk, I'll say it again, is to have one other household visit between December 24th and December 28th. While they're visiting, remember, masking, distancing, and hygiene is paramount. You have to follow those rules. And I know when people come to visit, people forget about the 2 meters, right? 2 meters is actually pretty far. People try to get really close, you know, they don't respect those distances. Really, you have to follow them. This is the only way that we're going to be able to stave off the effects of coronavirus. As we said before, as I've said before in a number of updates that I've done, we cannot stop coronavirus from coming here. All we can do is slow down its effects and slow down the effect it has on community members and those who get the virus. Private home visits should not occur. And what that means is you can't have parties, there's no gatherings of multiple households or multiple family members from different households. So I know it's the holiday season and I know that people want to get together, but you can't, okay? So if someone comes over to visit you, say on December 24th, right, your son or your daughter, and they have their family, that's all that can come to visit. You can't have other sons or daughters come over at the same time or come over at a later time in that day. It's one visit per day. Right? So they can come over on the 25th, they can come over on the 26th, all the way up to the 28th. I know it's hard, I know it's going to be a struggle, but it's the safest and best thing that we can do during the holiday season. Really, the safest way is not to visit at all, right? You're going to kind of have to chalk up this Christmas as something different, right? Hopefully it's an anomaly, hopefully it's something that we don't go through again, but I mean, the reason that the task force makes these measures and these guidelines is to create a safe community, right? We're already in a situation, and the situation, we had a task force update meeting yesterday, and the Commissioner of Public Safety used the word dire, right? Lloyd used the word dire, and dire is not a good situation to be in. And even though we were doing very well before, it's starting to look, you know, not so good now, and it's getting worse and worse and worse. And before it goes out of control, we need each and every one of you to be responsible for all of us, right? So the task force, the peacekeepers, the fire hall, the hospital, everyone who's involved in this community, not just first responders, but people, you know, just the regular person on the street in Kahnawake has to follow these measures. Distancing, masking, hygiene, no visiting, no gathering. You know, I know there's guidelines and we're saying one family, 1 day per day from December 24th to the 28th. But if you can manage not to have any visitors, more power to you. Private home visits should not occur, and they definitely shouldn't happen. If you have visitors that are coming over, make sure that you're not in that risk category, that you're over 70, you're immunosuppressed. All of those things are big factors. You don't want to put yourself in a situation where you're going to contract this virus. You know, Kahnawake has done fairly well so far, but you got to make sure that you follow the measures. Anybody in these risk categories during the holidays, sorry to say, you should just stay home. Find alternative means to communicate with family on, like, through Zoom or Facebook or something like that, because we really want you to be safe. We don't want anyone to become a statistic. We don't want to have fatalities in our community. That's why these things are occurring. We're at a critical point in our community, and everything that we do from here on out, you know, decides whether or not we're successful at the end of this or not. And the task force, one of the biggest fears that I have is that during the holiday season, people are just going to say, it doesn't matter, we're just going to do it, and then we have outbreaks everywhere in the community. So we don't want that to happen, so please follow the measures in place. Please, as much as possible, do not visit, right? Even though there's a guideline that says one visitor, one household visit, as much as possible, try not to do it. Throughout the holiday season, the Kahnawake Peacekeepers are going to be out there. We're going to be looking for people who are contravening the various directives that the task force has. Throughout the time of the pandemic, we've tried really hard to be community policing minded, and for the most part, it's worked really well, and I really appreciate all of those community members who have really followed along and towed the line and been really good partners to all of emergency services. But we're in a difficult situation now, and we're left with no other alternative but to use enforcement, right? Everybody's been warned, everybody's been spoken to. We can't continue to do this. You know, the next step is enforcement. So please be aware of that. It's the Christmas holidays. We don't want to do it, but we're left with no other alternative. The border crossing issue. I mentioned it in the directive. I just want to revisit it. So what will happen if you fail to do your 14-day isolation when you cross the border? If we find you not respecting the directive, you will be issued a fine, okay? You must follow this directive. This is now effective in our community. It's the only way that we can be sure that we can stop the spread of coronavirus. I know lots of people think it's not happening. It is happening. It's a reality. It's a worldwide pandemic, and we all have to be responsible and try to do what each and every one of us can to mitigate its effects in our community, right? Safety and security. It's all of us. We're all partners in this. We have a number of people in our community who are isolating or quarantining themselves, you know, because they've had contacts with maybe people who are positive. We have a number of community members who have tested positive. We know who these people are that are quarantining, and we know who the people are who are positive. So we're expecting all of these people to follow the measures, to follow the rules. Public health has told you that you must stay in, you must isolate yourselves from others. This is a reality. You have to do it. If we find anybody contravening that, they will be issued a fine. So please, everyone in Kahnawake, be safe, be healthy. I hope you have a great holiday season. This won't be my last update, but I wanted people to understand, and I wanted you to be aware of what the new measures are. Distancing, masking, and hygiene, those are vital. Also, don't forget, your mental health is a key. Have a good holiday, everyone.
Thank you very much, Dwayne. As I stated at the beginning of the program, lots to report on, and this is a very important time in this community's history. As a matter of fact, I think there's no better way of putting it. Just a note before Dr. Gauthier comes up, Step by Step in 7 generations will remain open and service to all their and have service for all the families that registered up until the holiday season. They do a half day until 24th. On the 24th, it's a half day, then they're off for a bit. But if you can, have your children at home, if at all possible. We're trying to do everything in our power to keep the spread at bay. All right, coming up next, Dr. Annick Gauthier is going to be joining us. It was actually recorded yesterday. Her presentation was recorded yesterday because she's very busy, couldn't be here in person. But she's not only a family doctor here at Zacharie Memorial Hospital Center, but she's a noted virologist. So she really has a handle on what the COVID virus is all about. She's been on the program before. The first part will be a little bit technical, and then she will get into, I guess, the meat of it. But you really need to follow this from the beginning. It won't be too long a presentation, but I think you're going to find it very interesting. Dr. Gauthier?
So you've heard the news. There are COVID-19 vaccines that are available, and the data shows that they actually work and prevent COVID-19. Many of you are ready to roll up your sleeve and put your arm out and get vaccinated, but there are a lot of you who have questions, and that's completely normal. The most often question that I get from my friends and my family and colleagues and patients is, am I going to be vaccinated? And my answer is absolutely, as soon as it's my turn. So there's a lot of you ask us, how come information changes? And the reason for this is because the beauty of science is that it evolves with the data. It evolves with knowledge. So science isn't black and white. Science is grayscale. It's a collection of grays that lead the answer to be more black or more white. So the goal of this talk is to explain what RNA vaccines are and how they work. The second is how effective and safe are these RNA vaccines. The third is the initial plan of priority and timeline. And the fourth is question and answers to many of your questions. So what's an RNA vaccine? So really it's a combination of the central dogma of life, which is DNA to RNA to protein plus immunology. So I'm going to give you an analogy, and that's why I have all the Lego out here, and I'm not sponsored by Lego doing this. Okay, so we're on our family, we're going to make this Lego, a gingerbread house. And so if you look at the whole Lego manual, which is like pages and pages long, this is like the DNA. It's the overall instruction manual. But the RNA is like the mini instruction manual to make part of this big structure. And specifically, we're going to make this Christmas tree over here. And the Christmas tree is like the protein. And then the little tiny Lego blocks that make up the protein are the amino acids. So if you only had the instructions to make the tree, you wouldn't be able to make this entire gingerbread house. So that's basically the concept behind this RNA vaccine. We're giving the cell instructions only to make the Christmas tree, which is the SARS-CoV-2 spike protein. Now, if I gave the instructions, okay, to the cell like this, so the RNA directly naked to the cell, it would be immediately degraded. So it's sort of like if when this comes in the package, it doesn't come as a paper book, it comes inside a plastic bag. And the reason for that is to prevent anyone spilling anything on it, water, destroying it. So the same thing is happening with the RNA. They actually take the RNA and they wrap it in sort of like plastic lipids, which are fats. And then that is injected. Now, the RNA that's wrapped in the lipid particle gets injected into the muscle, and then it gets taken up by the immune cells, and they're like, oh, this RNA, I know what this is. I'm going to make something. I make a protein out of this. So it goes and it makes this protein. But it looks at it, the cell, and says, I don't know what that is. That's not me. And so when it knows that it's not itself, because our body is trained and our immune system is trained to know what self is, it goes and puts this on the surface of the cell. And that then recruits all the other B cells and T cells to create an immune response. Now that RNA, by the way, is just like this paper book. It's not very stable. It's not going to last for a long time. So within a couple of weeks, that RNA is gone. And you have the body reacting to this protein on the surface that again also goes away, but that memory of the B cells and the memory of the T cells stays. And then what happens is if your body in the future encounters the SARS-CoV-2 virus, which causes COVID-19, your body's like, hey, I know that Christmas tree. That is not me Christmas tree. I'm going to attack this Christmas tree and prevent the virus from replicating. So overall, this is not the entire virus. It's one protein. You can't get COVID-19 from the vaccine. Just like if I only gave you the instructions to make the Lego Christmas tree, you would not be able to make the whole gingerbread house. So my second point is how effective and safe are the RNA COVID-19 vaccines? So there's two vaccines, one that's approved, it's the Pfizer-BioNTech. You've also heard it by the name BNT162b2. They looked after up to 112 days after inoculation, and there's really has to be 2 doses, the first dose and then 21 days later, a second dose. And you have 95% efficacy in preventing a symptomatic COVID-19 infection. There's no change in efficacy based on age, ethnic origin, or comorbidities that are known to be involved in having the worst COVID-19 outcomes. The adverse effects from having the vaccine are sort of more than a flu vaccine, but not as much as the shingles vaccine. So there's going to be pain at the injection site. That's about 84% of people have that. There's fatigue, 60%. Some people have headache. A good 50% of people have a headache. Some people have muscle pains and chills. Fever, it's about 14%. However, as we all know, getting COVID-19 is worse than this. What's also very interesting with these vaccines is you actually have better immunity than with a natural infection. Both an antibody, so B cell mediated immunity, and a T cell mediated immunity. The other issue is the Moderna vaccine. That's one that hasn't been approved yet, but it's about to be approved. That's also made by NIAID. Its name is mRNA-1273. And there's protection against infection up to 12 weeks. Again, it has very similar efficacy of 94%. It's similar across ages, genders, ethnic origins, and comorbidity. What very interestingly they show is it actually prevents severe COVID, and it works after 1 dose, although to less effects, and it works in those that already have COVID-19. There's a very small amount of data showing that 60% prevent an asymptomatic infection, therefore prevent transmission. But the idea with all these vaccines is that if you prevent symptomatic infection, you're going to prevent spread, because we know that the most people that spread have symptoms. Again, the side effects are very similar to this vaccine. Pain at the injection site is like 90%, and then fatigue and headache and so on, and muscle pain. There's also been shown some lymphadenopathy, so that's like lymph nodes that are swollen. That happens in about 21% of people under 65 and 12% of over 65. But some of that makes sense because that's where our antibodies are made, is in our lymph nodes. There's been no anaphylaxis or severe hypersensitivity seen with this virus. Now, what we don't know, the length of protection. We only have data up to 112 days. We don't have long-standing data. We don't know what happens in special groups. So people under the age of 16 were never tested in these studies. People that are breastfeeding, that were pregnant, very few HIV positive patients were tested in these. Some of these actually, in retrospect, have a few of these members, and they are being analyzed currently. Does it protect against asymptomatic transmission? It's presumed, as I mentioned, but it's not known, and we need to have more data, and more data is being collected on this. And as I mentioned, the Moderna vaccine does prevent 60% of asymptomatic infection actually after only one dose, and we're still being investigated what happens after 2. But overall, what this means is even with vaccination, the tenets still stand of distance, hygiene, and masking. So my third point is initial plan on priority and timelines. Compared to usual protein-based vaccines like seasonal flu, these RNA lipid nanoparticle vaccines are much more fragile. Because of the RNA, they actually need to be kept at very low temperatures. So the Pfizer vaccine has to be kept at -80, the Moderna vaccine at -20. Because of that, we need to really work and make sure we have a very good distribution system that's centralized. And so Public Health Canada and the individual provincial agencies like the NSPQ, as well as NACI, so the National Vaccine Advisory Board, are all working together to have very clear, so that we don't waste any vaccine. The plan is to go for those in long-term care facilities, the healthcare workers in those facilities, as well as healthcare workers that are working with people most at risk, people in isolated communities, and then by descending age throughout the community, as well as comorbidity. The trial sites have actually already started in Canada. In Montreal, closest to us is Maimonides, started on the 14th of December. The rollout for us to healthcare workers is actually planned before Christmas. The next point is some questions and answers. So can the COVID vaccine be given with other vaccines? And right now, the answer is no. We actually have to wait after you've had another vaccine for 2 weeks before getting the COVID-19 vaccine, and then we wait another 28 days afterwards. And the reason for that is we want to make sure you have a good immune response to the individual vaccines that you're receiving. Can pregnant women get the vaccine? So they weren't included in the trials intentionally. They were not included. There were, after the fact, found out that there were 23 people in the Pfizer trial that were pregnant, and those pregnancies are coming. However, this is not a live vaccine. This is a RNA vaccine, and therefore is not expected to be an issue. It's supposed to be decided on a case-by-case basis. So mainly if you're a pregnant healthcare worker, that may be something you would discuss with your physician. Can breastfeeding women get the vaccine? They weren't included in the trials again. More data is coming, but really overall, it's considered to be not a problem, and that it would not affect both the mom that's breastfeeding and her breastfeeding infant. Can children get the vaccine? So the Pfizer vaccine is only approved for greater than 16 years old, and we'll have to wait and determine when we're going to start vaccinating younger than that. Another good question is, do elderly develop a good immune response? Generally, older people don't develop as strong as immune response, but what has been seen in the Pfizer and Moderna studies is no difference across ages. So definitely elderly people should be vaccinated. Do immunocompromised develop a good immune response from the vaccine? So they weren't included in the trials, but it's not a contraindication. And it's likely that they will have a response, but won't be as robust. Can the vaccine, can you get it if you've already had COVID-19? And yes, actually, the Pfizer trial had 4,000 people who already had the COVID-19 actual virus and were cases with symptoms. And they, after they had been fully finished their isolation and finished their COVID-19, were able to get the vaccine, and they had similar immunity to all the rest of the trial. What if you're allergic? So there's no absolute contraindication, but those with a history of anaphylactic allergy, there's a warning, and a risk-benefit analysis needs to be done with your healthcare provider. The exact mechanism of why there were some instances where anaphylaxis was seen in those that had severe anaphylactic allergy, and when I talk about that, it's having anaphylaxis requiring an EpiPen shot. Can this RNA vaccine be incorporated into our DNA and change our cells? The answer is no. So human cells don't make reverse transcriptase. So in order to be able to take this RNA and put it into our cells, we would need to take this RNA and be able to make the DNA, the whole book. And our cells don't have that ability, as well as our cells can't take that DNA and have something called an integrase to integrate into our genome. So that's just not possible. How long will immunity last? That's another great question. We don't have data beyond 3 months. It's expected that it lasts longer than that, but at the moment we don't know. However, if we can have greater than 70% of the population vaccinated, that will create a herd immunity, and we will be protecting everyone, and therefore not having COVID-19 anywhere to be able to replicate or live. What are the long-term side effects? Well, we don't have data beyond 3 months. So we don't know, but right now everything is actually looking very positive in terms of that after 3 months there are no long-term side effects of the vaccine. Now, we all do know that having COVID-19 has long-term side effects. So at the moment it looks much more promising to get the vaccine than to get the virus. And then the last point I want to make is that we have better immunity from the vaccine than we do from the virus. So I encourage you all, when it's your turn, to get the COVID-19 vaccine. Thank you.
Of course, Dr. Gauthier proving once again that Lego is a very educational toy. And we'd like to thank her for that very important information. And we'd like to thank everybody for joining us today. We have a couple of other notes before we leave. First of all, wanted to mention that Kahnawà again has Community Services has put together a video presentation that we are going to invite you to watch. You can go to Kahnawà 911 and it'll be posted up there in the next few minutes. And it's information, I think, for those who are having a difficult time. It should be of assistance. It'll be up there for a while. It'll also be back on Paul's cable. So when you watch the updates, you will be able to see it in the rotation of the programs that are there. Also, we'd like to mention that Paul's Cable is back up on a more regular basis. You are able to see these updates as well as live just about every day on K1037. We'd like to thank the local media for always being of assistance in getting this important message out to our community. And a final note here is that the comments on our live broadcast here on Facebook Live, the comments have been disabled, and we're having some problems with that. And if you really need to get in touch with the task force, it's always a simple matter of contacting us at 450-632-0635. And any questions you have will be answered, and that should be that. So, after a long week, we'd like to thank you for joining us. Stay in good health, everybody. Wash your hands, wear your mask, and maintain that 6 feet or 6 feet of distance, and we'll all get through this together. Take care. Nyauko dano onigiwahi.